Just because your blood pressure is still high does not automatically mean you are doing something wrong. In over 2 decades of practicing cardiology, the most frustrated people I have sat across from are not the careless ones. They are the ones trying hardest. They cut the salt, read every label, walked every morning, quit smoking, cut back on alcohol, doing everything right. And still every single time they come in and we put that cuff on their arm, the number is still high. Not once, not during a stressful week, consistently every time. And that is the moment I watch people just deflate right there in front of me because every one of these patients was handed a simple promise. Do the right things and your blood pressure will come down. And when the numbers don't move, they ask the same question. Dr. Denise, what am I doing wrong? And here is what I tell them. You are probably not doing anything wrong at all. The problem is not your discipline. The problem is not your food choices. The problem is a specific biological signal firing inside your body that nobody has properly explained to you. And once you understand what that signal is and why it stays switched on, everything that has been confusing you for months or years finally starts to make complete sense. That is exactly what we are getting into today. This is not a video about eating more salad. This is a video about what is actually happening inside your body when blood pressure stays elevated in people who are doing everything right. By the end of this, you will understand your own blood pressure better than most people who have been managing it for years. Most people were taught one simple model. High blood pressure equals too much salt. So the obvious solution is cut the salt, reduce sodium, stay under the limit. I am a cardiologist. I am not going to tell you sodium doesn't matter. It absolutely matters. But here is what I see clinically over and over inside my own practice. Some patients cut sodium aggressively and their numbers come down beautifully, almost immediately. Good response, clear mechanism, done. But then there's another group. This group cuts sodium just as aggressively. Same effort, same discipline, and their numbers barely move. Same intervention, completely different results, and nobody ever explains to these patients why. So why does this happen? Because for a large number of adults, especially once people get past their mid-50s, blood pressure is not primarily a salt problem. It is a hormonal problem. And the hormone at the center of it is one most people have never thought about in this context. That hormone is insulin. Now I know what some of you are thinking. Insulin is a diabetes thing. It is about blood sugar. It has nothing to do with my heart. I completely understand why you would think that because that is exactly how insulin gets talked about in most medical conversations. Blood sugar goes up, insulin brings it back down. That is the story most people have heard. But what almost nobody talks about, and what I consider one of the most underappreciated mechanisms in cardiovascular medicine, is the enormous role insulin plays in controlling blood pressure directly, not indirectly, directly. Every single time insulin rises in your body, it sends 3 very specific instructions simultaneously to 3 different systems. To your kidneys, hold on to sodium, don't release it. To your nervous system, stay switched on, stay slightly activated. To your blood vessels, not yet. Don't fully relax. Now that is completely normal when temporary. Insulin is supposed to rise after a meal, do its work, then fall back down. That is the healthy cycle. The problem happens when insulin never gets the chance to fall. And the reason it stays elevated has nothing to do with what people are eating. It has everything to do with when and how often. I want to be clear about where the science stands here, and I will not overstate it. The connection between chronic insulin elevation and high blood pressure has been studied in peer-reviewed cardiology research for over 30 years. The renal sodium retention mechanism is well established. The sympathetic nervous system activation is documented. What I'm describing is not a fringe theory. It is a recognized physiological pathway that in my clinical experience is under-identified in the specific patient population doing everything right and still not getting results. Let's use an analogy that clicks immediately. Think of your bloodstream as a highway. Sodium is the number of cars on that highway. Your kidneys are the exit ramps, and insulin is the traffic signal controlling whether those exit ramps are open or closed. Cutting salt reduces the cars entering. That helps. It genuinely helps. But if the exit ramps are closed, if elevated insulin is keeping those kidney exits shut, Then even with fewer cars entering, traffic still builds up. The congestion still develops because the problem was never only how many cars were coming in. The problem is the exits aren't opening to let them out. Now, here is the part that changes everything. Your kidneys do not care whether your food was organic. They do not care if it was homemade or carefully portioned. They do not care about your discipline or your intentions or how hard you have been trying. Your kidneys respond to hormonal signals. That is their operating language, and insulin is one of the most powerful signals they listen to. When insulin stays elevated, your kidneys receive one continuous instruction: retain sodium, hold it, don't release it. Not briefly, continuously, for as long as insulin stays elevated. So even eating very little salt, your kidneys are still holding on because the hormonal signal telling them to release it never arrived. The signal that creates release is a fall in insulin. And if insulin never falls, the release never happens. Chronically elevated insulin keeps those exit ramps partially closed all day long. No matter how carefully you manage sodium, this is exactly why salt restriction alone does not work for so many people. They are solving one part of the equation and completely missing the part actually driving the problem. And this leads me to something I get asked constantly in my clinic. Dr. Denise, why is my blood pressure highest first thing in the morning? I haven't eaten yet. I haven't had any salt. Why does it start high? Most people assume stress or cortisol, or just how the body wakes up. And yes, there is a normal morning rise in blood pressure. But when numbers are consistently and significantly elevated first thing in the morning, the answer very often has nothing to do with that morning. It has everything to do with what happened the night before. Late night eating, even something completely healthy, even something small, keeps insulin elevated through the overnight hours. And while you are sleeping, your body is still responding to that elevated insulin signal. Your kidneys retaining sodium through the night. Your nervous system never fully downshifting into the deep recovery state it is designed to reach. Your blood vessels never getting their full overnight relaxation window. The cardiovascular recovery your heart and vessels genuinely depend on is being quietly prevented by an insulin signal that should have fallen hours ago. And so you wake up before you have eaten a single thing, before a single stressor. Blood pressure already elevated because your body never actually reset overnight. You are starting the day already behind. Most people who experience this have absolutely no idea what is causing it. They have been blaming stress or age or genetics. And sometimes those factors are real, but very often the answer is much more specific and much more fixable. Now, here's where I want to introduce something I consider genuinely underappreciated in cardiovascular medicine, because the patients whose numbers don't move despite doing everything right, they don't always look the way you might expect. They are not always overweight. They are not always sedentary. Some of the most surprising cases I see are people who look genuinely healthy, active, fit by any visible measure, and their blood pressure simply will not come down. The reason in many of these cases comes down to something modern medicine still does not discuss openly enough. Normal weight does not automatically mean metabolically healthy, and this single distinction explains everything for a very large group of frustrated patients. There are two fundamentally different types of fat in the human body. Subcutaneous fat, the fat beneath the skin, the fat you can see and feel, the fat that shows up on the scale, and visceral fat stored deep inside the abdominal cavity, packed around the liver, the pancreas, the intestines. You cannot see it from the outside. It does not show up in your weight or your clothing size. And visceral fat is a completely different biological animal. Visceral fat is metabolically active tissue. It actively interferes with insulin signaling. It releases inflammatory molecules that disrupt hormonal communication throughout the body, and it drives chronic insulin elevation, even in people with completely normal body weight and completely normal blood glucose. Research in peer-reviewed cardiovascular journals has confirmed that excess visceral fat can be present not only in obese patients, but in those who are overweight or even normal weight. And that visceral fat, not overall body weight, is the primary driver of insulin resistance. Here is the clinical reality I encounter regularly. A patient comes in, normal BMI, normal weight, active lifestyle, fasting glucose looks fine, standard metabolic panel, completely unremarkable. Their doctor has seen nothing alarming in their labs for years, but nobody has checked their fasting insulin level. When we do check it, it is elevated. It has been elevated for a long time, their pancreas working overtime, producing more and more insulin just to maintain normal blood glucose in the face of visceral fat, interfering with insulin sensitivity. The glucose looks controlled, but the cost of that control is chronically high insulin. And that elevated insulin has been telling the kidneys to retain sodium day after day, month after month. This is the hidden driver. This is why these patients feel so confused and so defeated. On the surface, by every measure they have been given, they are doing everything right. But their internal hormonal environment is quietly working against them in a way nobody identified because nobody thought to look. So I want to be very direct. In my experience as a cardiologist, one of the most common and under-recognized drivers of stubborn elevated blood pressure in otherwise healthy adults is chronic insulin elevation caused by constant feeding. Not overeating, not junk food, not lack of willpower. Just never, not once during the entire day, allowing insulin to genuinely fall back to baseline. That single pattern playing out day after day is what I see at the root of this problem more than almost anything else. And it shows up in 3 very specific patterns I now recognize immediately when patients describe their daily routine. The first is what I call all-day grazing, small meals, frequent snacks, eating every 2 to 3 hours throughout the day. This approach was actively marketed for years as metabolically beneficial, speed up your metabolism, maintain energy, keep blood sugar stable. People who adopted it were following advice presented as scientifically sound. But here is what that advice did not account for. Every eating event triggers insulin. And when you eat every 2 to 3 hours, your body never enters a genuine low insulin state, not once, all day long. The second is liquid calories. Smoothies, protein shakes, fresh pressed juice, green drinks, even the genuinely healthy versions. Liquid calories are absorbed rapidly. They spike insulin quickly. And because they are liquid, they do not create the same satiety as solid food, which means people almost never replace a meal with a smoothie. They add it on top, they stack one insulin trigger on top of another, and because it feels light and healthy, they don't register it as a metabolic event, but it is. The third pattern, and in my clinical experience, the single biggest driver of stubborn morning blood pressure is late-night eating. Eating in the final 2 to 3 hours before sleep. Even something small, even something nutritious. Eating late means insulin is elevated when you go to bed. Your kidneys retain sodium through the night. Your nervous system never fully hands control to the parasympathetic branch. Your blood vessels stay in mild constriction instead of undergoing the gentle dilation and repair they need during sleep. Over time, this pattern gradually resets your blood pressure baseline upward. The set point shifts. What used to be your elevated reading becomes your new normal, and your actual blood pressure climbs higher from there. You wake up further behind every single morning because the cause is happening while you are asleep. You have no awareness of it at all. Now step back and look at all 3 patterns together. Grazing, liquid calories, late-night eating. Notice what none of them are about. They are not about eating bad food, not overindulging, not lack of discipline. Every single one of these patterns was either deliberately adopted because it seemed healthy or developed naturally as part of a busy, well-intentioned routine. This is not a character problem, this is a timing problem. Not what you're eating, how often, and how late. So, what actually fixes this? I want to be clear about something first. The answer does not require a radical overhaul. You do not need a ketogenic diet. You do not need multi-day fasting. You do not need to count anything or eliminate entire food groups. What you need is what I call genuine insulin low windows, stretches of time during the day where insulin is given the opportunity to actually fall, to come back to baseline, to let the body do what it is designed to do when it is not in a constantly fed state. And when insulin falls, genuinely falls for the first time in months or years for some people, something happens in the body that I want to describe specifically because understanding it is what makes the protocol make sense. The kidneys shift out of sodium retention mode. They begin releasing what they have been holding, sometimes for a long time. Blood volume begins to normalize. The vascular walls that have been receiving a low-level signal to stay partially constricted start to relax. Not dramatically, not all at once, but progressively over days and weeks as the new pattern becomes consistent. The nervous system, which has been maintaining a mild background activation, begins to stand down, and the overnight repair process, the gentle dilation, the cardiovascular reset that should have been running every night, starts running again. Patients tell me something before they report a number. Something feels different in the morning before they even check the cuff. They slept more deeply. They woke up less tense. A background pressure they had stopped noticing because it had been present for so long. It is quieter. Then the number moves. I've seen this in my own practice. People who spent years on medication alone, who added these timing adjustments, and whose numbers moved in ways that genuinely surprised me. The fix was not a new drug. It was giving the body the one thing it had been denied. Time without insulin elevated, time to reset, time to release what it had been holding. In practical terms, the implementation is straightforward. Stop eating between meals. Let real gaps exist, 3 to 4 hours between eating events where the body is not processing an insulin response. That is the minimum gap that allows insulin to genuinely return toward baseline. Finish dinner earlier. Even shifting your last meal 1 to 2 hours earlier makes a measurable difference in overnight insulin levels. The research on time-restricted eating, specifically eating earlier in the day, shows consistent improvement in both blood pressure and fasting insulin across multiple clinical trials. The mechanism is not calorie restriction. It is giving the overnight window back to the body. Eliminate late-night food completely, not reduce it, eliminate it. The nutritional quality of what you eat late is never the issue. The timing always is. And timing is something that can be changed today. Compress your eating into roughly a 10 to 12 hour window. First meal at 8 in the morning. Last meal by 6 or 7 in the evening. That window gives the body 10 to 12 consecutive hours where insulin is low, where the kidneys are releasing instead of retaining, where the nervous system is standing down, where the vascular repair that should have been running every night can finally run. When insulin falls, genuinely falls, the cascade runs automatically. Your body does not need help with the repair process. It needs the window. That is what changes the internal environment, and that is what changes the number. Chronically elevated blood pressure is not just a number to manage. It is a signal. Your cardiovascular system telling you something has been under sustained mechanical stress for too long. When you fix the insulin signal, when you give the body the windows it has been waiting for, you're not just moving a number on a monitor. You're reducing the load on your heart, your arteries, your kidneys, and your brain simultaneously. That is how people maintain real cardiovascular health into their 60 seconds, 70 seconds, and 80 seconds. Not by chasing numbers, by understanding and then addressing what is actually driving them. If this gave you clarity on what is happening inside your body, please subscribe. It helps get this information to the people sitting frustrated in waiting rooms, wondering why nothing is working. And now that you understand the insulin mechanism, the next question is what you can do physically to bring blood pressure down. Because exercise matters here too. But not all exercise works the same way. I made a complete video on the 3 specific exercises with the strongest evidence. That video is right here.